In our health lead, cases of monkeypox are popping up around the world. Spain, Portugal, Italy, and the UK all confirming cases of monkeypox today. Canada announcing that they have identified 17 more possible cases after a case was reported earlier this week. And here in the U.S., one man in Massachusetts is recovering in the hospital from a confirmed case of monkeypox. CNN's Elizabeth Cohen joins us now. Elizabeth, for many, this might be the first time they've ever heard of the monkeypox virus. What are the symptoms of this virus? How does it spread?
All right, so let's go over what the symptoms are. Initially, the symptoms look like a whole bunch of other things. It's swollen lymph nodes, fever, but then after those, shortly after those, you get that telltale rash with lesions all over the body. This is why the contacts of the person in Massachusetts are being told to watch out for lymph nodes and fever. Transmission is through prolonged, and I want to emphasize prolonged face-to-face contact and direct or indirect contact with bodily fluids or those skin lesions. And just to give you an example, this has happened before. In 2003, there were 47 cases in the U.S. Jake?
Are we hearing anything more about those possible other cases abroad?
We are. Let's take a look at places that have had confirmed or suspected cases of monkeypox. So we've heard of confirmed cases in the US, UK, Portugal, Spain, and Italy, and Canada has suspected cases. I want to be clear here. This is an interesting thing that a CDC doctor said earlier today, that many of these global reports are occurring within sexual networks, when people have very close contact with each other, especially if those lesions have started to form. That can be a way that monkeypox spreads.
After the coronavirus pandemic, I think there are probably a lot of Americans who would get nervous when hearing about a new virus outbreak. Could this spread on an international level the way that COVID did?
The experts we're talking to say that that is quite unlikely. This is much, much harder to spread. It just doesn't spread in the same way. And I think the UK National Health Service, they summed it up quite nicely. They say on their website, it's very uncommon to get monkeypox from a person with the infection because it does not spread easily between people. As the CDC says, you need prolonged contact or contact with bodily fluids. This is not a COVID situation. I know you might think, wait a minute, didn't we hear that at the beginning of COVID, that this was containable? This is different. We do know something about monkeypox. It has happened before. For example, in 2003, when we saw those 47 cases, it ended at 47 cases. Obviously, COVID did not end at 47 cases. Jake?
All right, Elizabeth Cohen, thanks so much.
Miss Smith, fuck y'all. Yeah, I know you lying right now.